almost everyone that does Regen Med is what I call a one-trick pony, right? They can produce some PRP, maybe they can produce some bone marrow concentrate with a little kit, but they don't have a lab doing this. Why don't they have a lab like we have a lab? It's expensive. Our lab cost $1 million to build. It costs hundreds of thousands of dollars a year to maintain. And that's versus a little kit where they give you the centrifuge and then you pay on a per click basis for each kit, maybe a couple $100. Now, why do we use a lab? We use a lab because we can make all of those different things. We can make low dose PRP, high dose PRP. We can make leukocyte rich PRP, leukocyte poor PRP. We can make platelet poor plasma, PPP. We can make platelet lysates of various concentrations. We can make a 1 fraction stem cell bone marrow concentrate, a 2 fraction stem cell bone marrow concentrate. And you just can't do that with kits. So obviously, if you're seeing a provider that uses kits, that provider is limited as to what they can offer you. So yes, for instance, PPP has been shown to be better for muscle tears. So in muscle, we'd be using PPP. Around nerves, we've seen platelet lysate be more anti-inflammatory and pro-nerve regenerative. So that's what we're using around nerves. For injecting a disc, for example, leukocyte-rich high-dose PRP would be much better than leukocyte-poor medium-dose PRP. Again, if you're using a kit, you can't do that stuff. But since we've got $1 million lab, we can do all of that and more.